Well, thanks for having me today. So my presentation is going to be a little bit different. I'm not associated with completely with county government or the municipalities in my community. However, the County Department of Health and Human Services agency plays a major role in the work that we do. But I'm really talking about how community members have come together to really try to advance healthy food procurement through a regional process, both in the hospital and the school setting. I'm with the San Diego County Childhood Obesity Initiative. I wanted to start just to give you a little background on our organization because it plays a major role in how we have been able to advance healthy food procurement in our community. We are a public-private partnership. We were initiated over 7 years ago now, really through the support of our County Board of Supervisors. We are pretty much the brainchild of Supervisor Ron Roberts and Pam Slater-Price. They were already starting to see data that was coming down, that this was a trend, not only nationally, childhood obesity, but it was an issue in the county as well. And they felt that they could make a difference and really change the tide if they were to start doing work immediately. So what that entailed was really a year-long informative research process where they were asking other communities how they were addressing obesity. And they really identified that if they were going to make change, it had to be through policy and environmental change, and it had to focus on the 7 key sectors of the community that they felt really had the most influence. And that's everyone from government, healthcare, schools, community, media, business, basically everyone. And so what we do is we really work together to bring together all those partners in work teams. We like to refer to them as small think tanks, where we've developed a countywide action plan. Our organization is responsible for its implementation, but we really engage others in taking on those activities both within their sector and then thinking about how their sector can influence the community at large. We've defined 4 major goals for our initiative, one being increase opportunities to access and eat healthful foods in a culturally appropriate manner, increase opportunities for physical activity. We really believe that smart solutions solve more than one problem, so increase other opportunities to enhance economic, social service, and built environments, and then really maintaining that public-private partnership. That's very dear to all of our work groups and all the work that we do. But the more that we tried addressing increasing access to healthful foods, really the more that we found out food systems, it was a food systems approach that needed to happen. When we started this work, it was probably about 5 years ago that we started to talk about there were systems that needed to change in our community. We are a very different type of agricultural setting than most communities. We have the 18th largest agriculture economy in the U.S. At the same time, we have the 5th largest population of any county in the country. All these things really led to conditions for change. We had a very well-working obesity initiative that included more than 200 partners from across our county. I failed to mention that we are actually facilitated by community health improvement partners. When the state legislated that nonprofit hospitals approve their community benefit and do their triannual needs assessment, in San Diego County, the nonprofit hospitals and many of the private facilities and the County of San Diego decided to come together to really do that needs assessment and then to address the priority health needs. So we have a very strong background of collaboration partners. While we may have a competitive healthcare environment and there may be competition among nonprofit sectors, we do know how to work together. There was also really a sense of urgency and interest, I think, around the food system. We were beginning to better understand our agricultural landscape and that there was demand for change within our community. We know that about 2.5% of all cropland in the U.S. is in fruit and vegetable production. So what does that mean? It means that we're lacking enough fruits and vegetables to actually meet our daily recommended values. And in San Diego County, while we have one of the largest agricultural communities, we have more than 6,000 small farms. About 2/3 of those are in ornamental production because of the price of land and water. And then the remaining are in high crop value produce. So we're talking citrus, avocados. So we have a variety of produce that's available to us outside of that, but the majority of it really is in those two crops. But again, there's been a growing sense from the grassroots to our health department to organizations really wanting to move forward. Schools were starting to say they were interested in farm to school. Hospitals were starting to think about things like antibiotic resistance and its connection with meat production. So we knew we wanted to really move forward. So what we did, these two programs didn't start simultaneously, but we have been learning from them and applying best practices to both. But we initiated both the San Diego County Farm to School Task Force and then the Nutrition and Healthcare Leadership Team. And what we did in that process was originally San Diego Unified and Whole Foods had been in discussion about really wanting to make change in their cafeterias. And the conversation really started simply by the food service director being in the grocery store and saying how much he wished that he could have that product available. So other food services were really hearing that they were talking about how to make this a practical reality and wanted to jump on. Our organization, being involved in collaborations, really wanted to support that, so we partnered with Whole Foods Market to start the collaboration. With the Nutrition and Healthcare Leadership Team, there's been a national movement with initiatives like the Healthier Hospitals Initiative, which is really taking the best practices from organizations like Healthcare Without Harm that are working in sustainability and food initiatives and really creating a metric around it so that hospitals can identify their change in sustainability in 6 different issues, including healthy food, and then being able to really relate it back to the return on investment. In both of these groups, as one of our first steps was really to identify co-chairs. And why we did that was because there is definitely a different set of expertise and knowledge and buy-in if you're pulling people from the sector to really lead the initiative. But in both groups, even though we work with nearly half of the school districts in San Diego County as part of the task force, and we work with the majority of the major healthcare systems in San Diego County, those groups are also inclusive of others that are important to really making changes in that sector. So the San Diego County Farm to School Task Force, we work with distributors, we work with growers. Basically, we work with anyone who has an interest in really moving it forward. We are really trying to move forward in creating metrics around the work that we do. When we started, this really was a group of those that were passionate and cared about the issue and wanted to make change. And we wanted to make sure that we really could calculate that change. So what we've done in both of those groups is we're making sure that we're coming to a common understanding of what the issues are, that we're trying to come to common terms and language about what we're trying to affect, and then really defining our goals in each of our areas. The goals in the red are those of the Farm to School Task Force. They're really focusing on increasing education and awareness about the education or about the connection between student health and food systems. And this isn't so much a goal for the community at large, but for moving the movement forward in school districts. A lot of the food service directors came forward and have said that they basically need a lot more education in this area. They don't have all the information about the San Diego's agricultural system. They don't know why this is necessarily important to student health. Is there a difference between local produce or produce that's shipped in from anywhere? Is there a difference between organics and non-organics? So they have a lot of questions and really want to make sure that this is a professional development opportunity. So if they're moving this forward, they have a reason to buy in. Also creating and fostering opportunities for collaboration, making sure that they're learning from the best of what's happening, increasing actual farm-to-school programming, and promote farm-to-school when it's happening through the media. and also increasing opportunities through policy. With our nutrition and healthcare leadership team, they're really making sure that healthful food is the standard within their facilities, changing the norms, also beverages, and then really leveraging their collective buying power. I should mention that we in San Diego County, the schools serve over 300,000 meals a day. They're required as part of their lunch meal to have a half a cup of produce with every meal for it to be reimbursable. That is a lot of purchasing power when it comes to produce and a lot of opportunity for our local growers. We also have school sites that range everywhere from one school in a district to over 300 school sites. So there's really, I think with school districts and what we're learning, and depending on your county, there might be an opportunity for farmers of all scale to participate, and really just matching them up with the school district that makes the most sense for them. And then our hospitals, we have millions of dollars in purchase power, and they're very aware of that. And most of them work with the same GPOs. So they really want to use their voice to get the product that they would like. And then raising food literacy and supporting evaluation and tracking this is of particular importance in the healthcare environment. When it really does, at the end of the day, it comes down to two things. They want to improve the health of their patients, and they also want to make sure that their return on investment is secure. So as I mentioned, we're trying to move forward through shared measurements, through our strategic planning and having defined goals. We're working to really define local. In San Diego County's Farm to School Task Force, we've used the same definition for local pretty much as San Diego Unified. We're not trying to recreate the wheel. So our definition of local is 150 miles, San Diego local is within the borders of our county. Regional is within 150 miles of our county border, and then California is anything grown within the state. We are working on coming to common ground in the nutrition and healthcare leadership team as far as those definitions go. They have been working on healthy beverages. At the next meeting, we are set to adopt a standard for healthy beverages for hospitals across San Diego County as the gold standard. We'll probably be using the CDC's definition. And we've been working on using a lot of metrics and baseline tools to both gather data and then have something to compare against in the future. Our mutual reinforcing activities that we've been working on, everything from really promoting healthy beverages in the hospital environment is a big issue that's been moving forward in San Diego County. Rady Children's Hospital down there has really been leading the way and is now being cited as a national model. And we jokingly say that they're on a road show talking about how to really do this well. They made sure that they included it in their operating guidelines. They did a lot of employee engagement and education, and I will say that seems to really be key to how they were able to move it forward. And with they tracked baseline data 3 months prior to implementation, and then within a month of implementing their Rethink Your Drink campaign, they reduced sugar-sweetened beverages preliminary 30%, reaching their goal. But the idea is to sustain it throughout the year. The Farm to School Task Force, we have done a lot of work really to try to break down the challenges between local sourcing and make it a practical reality. We did a Growers 101 workshop, which we were hearing from growers that in San Diego we have a large number of growers that sell direct market. It's profitable for them. They get a high dollar return on their money. However, they also have to staff up their farmers markets to be able to do that. So we did a Growers 101 that basically provided them information they would need to know on how to sell to the school market, what were the different scales, what were the different options. You can go direct, you can go through a distributor. We also did a produce showcase which brought everyone together, distributors, growers, packing houses, and food services directors, so that they really made those initial connections. We had more than half, again, food services at school districts at that program. Along with mutual reinforcing activities, not everyone has to do the same thing. You definitely need leaders who are doing work that really helps bring their group along. San Diego Unified has definitely been that for us in our community through our county Health and Human Services Agency, through both CPPW and CTG. They have been funded with a farm-to-school specialist. They're actually adding their second farm-to-school specialist at the end of this month, or actually June. The first thing that they did when they got Vanessa Zeifman in, many of you probably know her, was develop an action plan. And that's a model that we're really trying to replicate, is you got to know where you're going and you have to set goals. How do you define local and what's your goal for your institution? They also, as I mentioned, they defined terminology. They also defined abilities. They really went and assessed how they were going to make it happen within their district. What was the staffing capacity? What was their equipment status as well. They partnered closely with my agency to develop a garden to cafeteria program. They also worked closely with the Department of Environmental Health. Again, a lot of this work really stems from communication with those who are in the actual industry. And one of the rumors that we were hearing was that this wasn't legal, you couldn't do this, that they basically were going to get in trouble if they tried to source garden to cafeteria product. So San Diego Unified, we partnered with County HHSA and DEH to really break down what were those rules. We did a training for all the food service directors across the county, and then we worked with San Diego Unified to really implement those within their district to make sure it was systematic as a model for others as well. They also have been working on an informal bid for local foods from growers 4 acres or less within 25 miles of San Diego County. This is really an interesting model for not only districts across California, but the nation as well. It's being highlighted by the USDA. And really the idea behind this is in the state of California, there's a national requirement that you can do an informal bid if you're under a certain number, but in the state of California, it's $83,400. So anything under that, schools can put out as an informal bid, meaning 3 requests. And basically what they're doing is...
For what period of time?
They update that number every year.
So is that an annual or?
It's an annual number, yeah. And what they were able to do is, one of the biggest concerns of the USDA regulatory body is simply that you are not allowing for free and open market. But in San Diego County, again, we have over 6,000 farmers. We have a number that are in produce, at least 2,000. So they put out an informal bid really asking, what do you have and what are you willing to sell it for? And they can select from the cheapest option, the product that they would like to get that's grown locally. They also recently put out their request for proposals, which is again a model for different schools throughout the country. This not only included their typical produce procurement for processed products, whole foods, but it also includes local foods. And for the RFP, usually for these more significant purchases, they would put it out as an IFB, but it wasn't necessary because they weren't quite sure how to get the product and the services that they wanted, which included everything from farmers' visits to tracking data for them on their actual local procurement sales, and then also just making sure that they could get product that met their local definitions. So this is something that's really interesting and unique, and because of time, I'll kind of breeze through that a little bit. But they worked in very close coordination with both the USDA, legal services, and then their own procurement department to make that possible. So Rady Children's Hospital, as I mentioned, has been working, and they have really been leading the way as part of our NHLT, and all of our group members have really been effectively mimicking kind of the work that they're doing in their facilities and making it their own. So we're very grateful to have those entities who are really leading the way and helping provide the technical assistance in how to make this happen in the reality of the facility. We do meet with each of these groups monthly by monthly, really making sure that there's constant communication. We just had an NHLT meeting yesterday, and simply being able to talk on a regular basis, figuring out whose vendor is who, what they're willing to offer one facility, making sure that they know that everyone's working in coordination. The change that you can effectively take in purchasing power is quite significant. We provide backbone support for all of this work. A lot of our accomplishments, we're very excited that we feel like we're really moving the bar. In San Diego County, when San Diego Unified first hired their farm-to-school specialists, they were going to source oranges from Staley Oranges, but because we were already meeting in this communication circle, we were immediately able to turn that around and have 10 school districts source that product at that time. What we're trying to do as we move forward is make sure that that's a regular process. We're trying to identify which school districts have what vendors. We're trying to work with the vendors and talking to them about how they can better label their product. What does local mean to the school districts that they're serving? Making sure that the things that the food services may not understand that they're empowered to do, helping work with them to make sure that they can make those changes. We just had a task force meeting a couple weeks ago, and we talked about contract procurement and what were the best practices, San Diego Unified, Poway, and in the room you could already hear discussion. We also had a rep from the USDA who was presenting and asked them really what were the things that were holding up the school districts and having them talk them out with the USDA so they felt safe in making those types of changes. With our nutrition and healthcare leadership team, as I mentioned, we're all on a strategic plan. We're really excited because we're already starting to surpass our goals. One of our goals was that everyone signed on to the Healthcare Without Harm pledge. 35%, we have 37% of hospitals in San Diego County have done that. We have a goal that by the end of the year, 24% of hospitals will, or 35% of hospitals will sign on to HHI's initiatives for healthier food. We're at 24%, but we look like we're probably going to have 60% of the hospitals in San Diego County that have signed on by the end of the year. Again, we have challenges. I feel like you heard a lot of them from the other presenters. Funding, tracking, competing priorities is always an issue that we're trying to address. Our lessons learned is basically you have to have a practitioner, you have to have someone who's really leading it from an inside institution. I think it's a great way for funders to put their money is to make sure that there's someone who can really catalyze change. A convener, a leverager is also necessary, making sure that those changes don't happen in a silo, but those best practices can be replicated outside of your community. Understanding the context for both food services, agriculture, your infrastructure, whether it's inside the kitchens or it's in the agricultural community, and then also making sure you understand the regulations. And that businesses are a key part of the solution. I think when we came together as a group, we didn't understand that we absolutely needed businesses at the table, but our businesses are the ones who, it's the growers who they do this for their livelihood. It's the distributors that this is their business. We need to be working very closely with them. And so I kind of wanted to leave my presentation off today with just a bunch of questions. Who needs to be at the table? I know that this is a collaborative of health departments from across the state. Who else needs to be at the department, or who needs to be at the table with you outside of your own institutions, and also who needs to be at the table from other government entities? I know that I think we would have gotten a lot farther along if we would have been working with the Department of Ag, DEH, HHSA, all the regulatory bodies at the exact same time, and that's really where we want to go. Where are the opportunities to ease the process and leverage knowledge, best practices? Who are your potential incubators in your community to really highlight best practices and to do it well? How can you promote countywide coordination? What's your ultimate goal and how will you measure it? Economic activity, nutritional content. Are we talking about moving the scale on 13 million acres of agricultural land that aren't in fruit and vegetable production that could help us meet our daily recommended values? And what support is available to your partners? And what support is available to you? That's one that I really want people to think about, is because the USDA is working very hard in the school environment to clarify their regulations. There's other partners that are really willing to work with you and support you in providing technical assistance as well. So those are my questions to you.
Right.